Peyronie's disease is a fibrotic tissue disorder which results from excessive amount of collagen that forms in tissues, especially in relation to Peyronie's, it's the penile organ or a male organ, where an excessive amount of collagen deposition causes a fibrosis that is noticeable as a palpable plaque or a kind of nodule. That nodule is what is picked up by many patients and sometimes by a doctor or a urologist who examines the patient. This fibrotic process, which is causing a hardness in the region of the penis, is therefore not elastic. And as it's not elastic compared to the healthy tissue which surrounds it, which undergoes a relaxation and contraction during the erection process, this brings about noticeable changes in the penis. And men go through the suffering of a progressive change, which could lead to any of the phenomena that a patient could suffer from. For example, the commonest could be a palpable nodule or a plaque, which is palpable on the shaft of the penis during non-erect states. In erect states, it can bring about a curvature or a bend. The bend could either be ventral towards the bottom or bend could be towards the top, which is called a dorsal curvature. There could be pain in the shaft of the penis, which could be during erections, but sometimes can be even without erections. The plaque initially can be tender, but later on with anti-inflammatories, as the pain and tenderness goes away, the pain can still be there in the immature form of the disease where the pain comes more during erection phase. People may complain of curvature, people may complain of pain, may complain of plaque. They may also complain of some kind of misshapen shaft or some kind of indentations or hourglass deformities which can develop in patients as a result of the changes happening of more than one plaque. So plaque can be one or can be multiple. Some patients can complain of loss of length or the shaft is getting shrunken. Some may complain of a shaft getting shrunken in terms of the girth of the penis. With all this comes erectile dysfunction. So complaints of Peyronie's disease could be, number one, overall erectile dysfunction. Number two, the length of the shaft getting shrunken, or there could be a girth deformity in terms of it becoming narrower. People could complain of indentations or misshapen shaft or grotesque looking shaft, or could be an hourglass deformity. People could complain of curvatures or bend, which could be a commonest kind of progressive complaint that individuals may complain of. And then there's a possibility of people having pain in the shaft or penis, something which wakes them up and brings them to light, and they come and see a urologist. With all this happening around a palpable nodule, which is an inelastic kind of a fibrotic process happening, men continue to undergo a little bit of an agony initially, and then it's more of a suffering in terms of not being able to come out of the tribulation of this deformity, which is progressive. Therefore, becoming incapable in the bed, while otherwise the shaft may look normal under non-erect states. Now, when the entire aspect of Peyronie's disease progresses, people know that this is a progression which is going towards a situation from where changes have to be brought about. And those changes will only come where there could be reversal. So people ask, how does this happen? Now, there is no mistake of yours that the shaft underwent a kind of a gradual progression of curvature. Most commonly, it is thought about that there could be an acute injury, a kind of a strike, a kind of a trauma. I believe there could be micro injuries which happen continuing to bring about fibrotic process, and as such, excessive fibrosis is a part of this collagen vascular issue which happens around in the shaft of the penis. There are also genetic linkages in some societies around in the European nations, but we don't see much of that happening in father, children, and kind of lineages where patients ask questions about, does anybody in the family have had, which may for social stigma not have been discussed. And finally, there are some medications like beta blockers, like anti-epileptic drug called phenytoin, like glucosamines, chondroitins. There are a set of drugs which bring about a fibrotic reactions, and that could also be incriminated, maybe causal, maybe just incriminated as the cause of possible fibrotic processes or plaques which happen in Peyronie's disease. So when we evaluate patients of Peyronie's disease who come to Kokilabenhospitalmumbai Hospital in the Department of Urology, we look forward to an evaluation by a clinical examination, obviously hand-holding the journey of making them comfortable about knowing that finally it's treatable and curable. So we take away the pain component, which is a very important component in the early days of immature disease. But as the disease progresses, men continue to adjust themselves to various postures while the deformity worsens. And that's where the morale is down. That's where the capabilities are down. Many times the erection process and the length and the girth, etc., go down. If all that is happening together in a erectile dysfunction scenario, we got to handle the journey into multiple aspects. So let's discuss about something called as corporoplasty, something which we do by a patch graft that we look at. Instead of decreasing the size anymore, we increasing the size by lengthening the shaft, and that is called as a corporoplasty. Something where we deglove the shaft of the penis, very carefully take away the neurovascular bundles to one side, identify the plaques, incise them, make a proper room for adjustment so that we lengthen that side which is actually convex and straighten the shaft. Look at that on the erectile process of the table. And finally, with a graft patch that we place underneath the neurovascular bundle before we close the shaft and then keep the dressing for a few days along with the catheter. The healing process is thus initiated towards a recovery. A recovery towards a cure where the morale is on the lower side and we've not recovered while processes have been on and attempts have been made around. So friends, Peyronie's disease gradually could bring about deformity in terms of the shape of the organ, which brings about the kind of curvatures and the torque which can be corrected. In today's world, over the last 15, 20 years of work on this subject, we have been able to achieve that kind of an aspect where we bring about a penile rehabilitation in the end so that the penile shaft does not get shrunken. So an aspect of care which starts with hand-holding the journey right from the days of examination and evaluation to giving them confidence about a surgery in an organ which is so sensitive to them, which is unfortunately going through a process where individuals agree to a treatment which is towards cure. We look forward to straightening the organ, taking away the deformity, taking away the discomfort and the pain, and giving them the confidence of capability back again. And therefore, Peyronie's disease is curable. Peyronie's disease is treatable. In today's world, in those patients who have got plaques and are gradually having a shrunken shaft and finally would fail erections, they have a treatment too. In such situations, we would actually put a semi-rigid or an inflatable prosthesis as requested and demanded, so that on one way, you molded the plaque and given them a graft or a patch corporoplasty. On the other side, you've also given them a kind of a length which is desirable and which is capable enough, along with the erectile process, and the erectile process is brought about by those processes which is available today. So friends, Peyronie's disease is curable. With more and more patients getting a cure, it is important to come out of the stigma of living with a deformity, living with a stigma, and living with a discomfort that has actually, troubled many individuals around. As more and more individuals get treated, it feels proud to be able to help individuals in explaining to them what is going through each of the processes. So many people come with primary and secondary curvatures. So primary curvature is primary to be treated, and secondary curvatures are to be corrected so that you get a confidence of a straight organ, straight with those steps on the table, finally cured enough to have a capability back again. Thank you again.